from Bukoto SDA Church.
Liverpool of all clubs. Okay. That's a nice one.
My name is Justin Damulida. I'm married to a man. I'm an accountant and I worship from Namongo SDA Church.
Okay.
Good evening, everyone.
Good evening.
Sister Brenda is my name. I'm a business personnel.
Okay. Go saze mangu Brenda. Brenda kadde mwako. We didn't hear it.
Sister Brenda is my name.
If someone is almost breaking their neck to look at you, give them news.
I'm a business personnel.
Uh-huh.
I worship from Masaja SDA.
Uh-huh.
Yes.
Okay. Solomon, you have issues today.
Good evening, everyone.
Good evening.
I'm Tukahewa Robina.
Okay.
I'm business ready
Okay.
at Robina's Bridal in Chesugu.
Yes. Go ahead. Okay. There are more prayer requests. Pastor, I hope you are noting down the prayer requests.
Good evening,
Okay.
ladies and gentlemen.
Yes.
I'm called Kansime Sarah from East Kampala, a lecturer at Bugema University, stroke a businesswoman. I'm happy to be here. It's my first time. I've been promising, but today I've come.
Nice to see you.
Good evening, everyone.
Good evening.
Sime Samuel Apuli is my name, and I run a tour and travel company called Apuli Travels.
Samuel, we'll talk about it later. It's all right. No, we'll talk about it.
Good evening, everyone.
Good evening.
I'm Alinda Caleb. It is my first time to be here, but I have been following everything via online. I was working from up country, but I would always follow up everything from here. So I'm glad to be here. Thank you.
Samuel, is there hope?
Probably, if God wishes.
Okay. Okay.
Hello, everyone.
Hi.
Good evening.
Good evening.
My name is Kajubi Joshua. I'm married. I work at Ministry of Finance in the procurement unit, and I'm happy to be here.
Okay. You're welcome.
Good evening, everyone.
Good evening.
My name is David Oyet. I'm a health manager practicing mental health, and mainly in the areas of awareness creation. I run a non-profit called Fine Minds Uganda.
Okay. Thank you, Oyet. Oyet is a friend of mine. I invited him to come and join us today. Okay.
Good evening, everyone.
Good evening.
I'm Musa Baluk by names. I'm 30 years old, and I pray from Cervical Town SDA Church.
Okay.
I'm an IT technician, electrical technician too, and I'm a vocal trainer. So, and I'm ready to be hired in everything of the above.
Okay.
And my intro is in September this year. Thank you.
Okay. Congratulations, Baluku. May God hasten the day. Pull it closer.
Well, the evening is good, and my name is Abel Mugabe. I worship from Source of the Nile Church, Ginger, and I wanted Brian to introduce himself first before I do, because he's one reason why I'm here. Brian.
Brian Aliwa. Brian. Okay, he's going to give us the other part. All right. Yes. There are any other? Who do you want to give the microphone, Debbie? Do quick. Wobo weddeyo ng'ogireta.
Good evening, everyone.
Good evening.
My name is Dr. Bakunzu David Barere. I worship from Bugema University Church, and I'm the first elder. I'm married and happily married. I'm happy to be with you here.
Okay.
Of course, to ready.
Doctor, you're welcome.
And I will be the one hosting you during the retreat of Kisoro.
Yeah! So you got, oh, stand up once again. Caption, you can get seated. So when we go to Chisoro, you know who we are looking for, right? Okay.
Good evening, everyone. My name is Mtiava Tom. I work with the Adventist Medical Center, located at Uganda Union headquarters. I'm a medical clinic officer.
Okay. Thank you, Bernard. And you're welcome. We are coming to...
Hello, everyone.
Yes.
My name is Dr. Ronald Bisegera. I'm also a married man with one wife who is a woman with 2 boys. I'm a resident of anesthesia and critical care at Makerere University. I also worship from SDA Church Chiti as an elder as well. Thank you.
Thank you, Dr. Bisegera. And nice to have you here. I want to have the microphone quickly in front here. No, the latecomers have a special hug. I will give her a special hug. You know the hug. It's coming. So latecomers, thank you for coming. When your time comes, you give me a hug, and then we give you the microphone after the hug. And this table.
Good evening, professionals.
Good evening.
My name is Nabulia Christine Trina, SDA Church Magere. I'm a fashion designer. Thank you.
Trina, what day?
I'm the assistant chairperson, fellowship committee. That is all.
You don't disappoint your MC.
Good evening, everyone. Ruth Nakalembe is my name. I am an M&E specialist with CFU, and I work on a project with maternal health and child nutrition with FHI. I am the treasurer.
One more. Okay.
Good evening to you all.
Good evening.
Suvi Deborah is my name, the face behind the golden base. I am a member of Najana Nkumbi SDA Church, but I worship from Bunga Central Church.
So you can talk about the other one while we are standing here.
I bake nice cakes.
Owangu de mugezi nnyo. Najana Nkumbi has people. And Bung as well. Okay. Gentlemen and ladies, we are also privileged to have our special people, God's very own anointed servants. Meetings like this, I tell you, they don't happen often. And today, we have a special delegation of wonderful servants of God. And I'm going to ask our very own Pastor Caleb to be the one to introduce the special people that have joined us in our midst today.
Thank you, Mr. MC. Caleb Mbabali Salongo.
Amen.
That is my name. I'm privileged to be practicing exactly what I studied. I work with Bugema University as a chaplain, and I'm happily married to Nalongo Lydia Nakalanzi Mbabali. Yes, I'm a fan of Liverpool, and apologetically, I just can't. All right, I want to welcome you so much because by God's will, I'm the chairperson for Fellowship and Evangelism Committee. Though my power is so much lying in my vice chairperson and the team. Actually, the team, people with whom we work in this committee, please raise up for recognition. Please, please, all of you raise up. Now, those are the muscles behind such an organization. Thank you very much. May God bless you. Now, we have the president. For this association of Adventist professionals, and that is Pastor Justus Perez. If you want to know his surname, you can meet him in person. But so far, it's Justus Perez. And he must be the head behind this as well, in one way or another. Hey, I had forgotten to announce. I'm an ordained minister. So, Kugonza on 11th, I can. All right. I don't know how much authority I'm having to introduce the visitors around when my president is present. Allow me invite the president to do the rest.
Thank you, Caleb. Good evening, professionals. I'm so excited to see all of you. We are happy and glad that you honored our invitation. We were running up and down, and when we couldn't see people, we were worried, but we have no reasons to fear for the future, lest we forget how God has led us in the past. I had asked many of you to come and advertise your businesses. That's why I brought my own here. So next time, please also emulate. It's good to support your own. This is my wife's business. We make clothes. We make you look beautiful. Gowns. I think it can speak for itself. We also teach you how to stitch. When we were growing up, we used to think that they are called tailors. Actually, they are called seamstresses. Okay? So if you want to learn, you come. It's affordable. We are honored this evening to have a number of visitors who have come along. Before I go any further, we launched Hope Channel. I have to talk about that because it put me on another level. And I was given a new name, Official Noisemaker of Hope Channel International. That is the title I have. And we have our manager, managing director with us, like he has been introduced, CEO, all titles are his, like I always say on the group. Everything, our manager, please stand up. Stand up. Manager, Hope Channel International, Hope Channel Uganda. Okay, that said, allow me welcome Pastor Ivan Sebagala, our chaplaincy director at Uganda Union. Please stand up for recognition. AAYP falls directly under his office. And we have been sharing earlier on, before we came here, that there is a need of bringing all these support organizations under one umbrella body, like you'll mention later on when the time is right. So it's important for us, as long as you have the name Adventist, it's important for us to come under one umbrella body because the target audience is the same. We are all targeting professionals. Why should we work individually, yet we are all aiming for the kingdom of God? So, Pastor, you're welcome. In the interest of time, I think you will introduce our guest then we can go on to the next program.
God is good, and all the time. I'm so glad to be standing in front of you today, and I'm so happy that I've this fellowship. Not for the very first time, because I was once here, I think twice. So I'm happy to be here today. That I'll be joining for the entire year and the rest of the years to come. I was going to join last month, but I had some programs that took me far up country. But I want to thank the Lord that I'm here today. I want to thank the professionals who have attended this fellowship today, those who have brought guests. We thank the Lord for that. We are so proud of this fellowship because it brings along professionals from different kinds of life and expertise, and there is a lot that we benefit from this. May the Lord bless you so much. I'm not the speaker of the day, but the role they have given me is to introduce our guest today. Is Pastor Emmanuel Pelot from East Central Africa Division. Pastor Pelot comes as the head of Adventist Laymen Services and Industries. The ASI. And as our president has mentioned, this is the umbrella that takes all the professional this is the umbrella department voted at the division to govern, to inspire, to direct, and to bring together all professionals for only one purpose: mission and discipleship. So if we have Adventist Media Association, that is an association for professionals. We have Aayp, that's an association for professionals. We have Adventist Business Friends. Those are not professionals necessarily, but they are also professionals in their own way. We also have students from public campus and even in our own universities. Those are also part of ASI. So this is the umbrella department that takes all the other departments where laymen from different capacities, including professionals, come together for mission and discipleship. But we'll talk about that when his time comes. So he is the head of the communications department at the ECD. And again, he is a special assistant to the president of ECD. So he is a servant of God, and he has experience in dealing with professionals and young people, and he is here with us today. So I want to thank the Lord for his coming, and when his time comes, I know he will do us good. May the Lord bless you.
Thank you very much, our very own pastor. We celebrate you and we congratulate you upon every victory. And we know that this office that you have been appointed to run, it was God's own appointment, and we pray for you. Gentlemen and ladies, the hour has come. In a special way, I would like to call a very special person, because this one has this most special message of the day. How many people, when you hear of the word cancer, what are they called? Goose pimples or the hair? Huh? Okay, how many people by all means you would want to live without cancer? Please raise your hand. Okay, let me ask this other question. How many people you would want to save a friend from getting cancer, and particularly cervical cancer? Raise your hand. Okay, now I want to know how many men are very privileged to be here so that they can go and serve the women around them. Now, gentlemen and ladies, today's session, the health professionals have prepared us to have a very particular topic. Prevention. That one. Prevention. But particularly, I know that all of us, by the time we leave here, in one way or the other, we will be able to support those that are battling with a problem, but also prevent ourselves if you are a woman, but also go and support the women around you. So, gentlemen and ladies, in a special way, I don't even have to talk much because I am not the one that is going to talk about this. Can we put our hands together to welcome Dr. Eleona on stage? Doctor, come running. Let's give her some energy. Some energy, 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 energy. This powerful lady is the one that is going to introduce to us our guest speaker of the day so that we can, have this cancer thing out of our way.
Thank you very much. Good evening, professionals. Nice meeting all of you. Yeah, my name is Elena. I am an obstetrician, gynecologist, passionate about public health, and a specialist in women's health. And it's always nice interacting with women, but also with men. And this evening, in a special way, from the health department, I want to introduce to you someone very special. We've seen the flyers around, but when I introduce her, she won't be happy when I introduce her as my boss, so I'll call her a friend. And it's the first time she's speaking in an Adventist community. A hand clap for that. And she mentioned something that she's excited. This is the first time in Adventist community, but she has a passion. She loves Adventist communities. She has interacted on different occasions. Dr. Sabrina Kitaka is a senior consultant, pediatrician, and a lecturer in Makerere University, College of Sciences, but she has something special. She loves adolescent health, and she runs a clinic, sexual and reproductive health, on adolescent health and so many other things. She's an author. A hand clap for that. She has written a very good book that I want to introduce to you this evening. And I request you that she has copies, so it would be good for us to have a copy of Suit of Excellence. That is a very good book that will keep us moving as youth. It really stimulated me when I read. I hope that also have this evening. She's a mother, and she's also a wife. Finally, before Dr. Sabrina comes here, Dr. Sabrina, allow me to say something special that I know about you. Every time she is called to serve, she will never say no. Yeah. And even if she's very, very busy, she keeps saying, Elena, you do not know whose life you're going to change. So that is something very special about her. So we are sure that she has come to change lives, and I pray that we listen to her passionately. Dr. Sabrina, as you come up front, a hand clap. Yeah. She is selfless in her busy schedule. She will make sure she comes. She's passionate about teaching and changing lives of youth. Thank you very much for asking to come and speak with us. Yeah, over to you.
Thank you very much, Eleona. Good evening, everyone. I don't know where I should stand to give this talk. I'd rather be next to the people I'm talking to here. Okay.
So I'm very grateful, first of all, for the invitation. And I'd like to say a big thank you to Pastor Justus Perez. I thought Perez was a Mexican until I saw him today. But I'm glad that we could even converse in the local language. As we discuss the topic, what is the role of men promoting or preventing cervical cancer? We discussed the topic, and I'm sure a lot of the men here think they are here because they are going to support women not to get cervical cancer, isn't it? How many of you came because you think you have a role to play? You're like Superman, you're going to prevent cervical cancer. Gentlemen, gentlemen, put up your hands. Yeah, you're Superman, really. But I want to let you know that HPV, or human papillomavirus, does not only affect women. Are you surprised? Did you know that human papillomavirus also infects men? Did you know that it causes throat cancer? Did you know that it causes penile cancer and anal cancer? Surprise. So, do not be shocked if I told you as well that human papilloma virus causes papillomas. And those papillomas in Luganda are called warts, genital warts. They look like cauliflower. Sorry about those of you who love cauliflower. But they look like cauliflower, and they can grow on your head of the penis. Excuse me, I'm in a professional group, but I'm also aware that you guys are Adventists and you can't say some words. But I am a doctor, and I beg that I use the words as they are so that you understand. Okay, there are no children below the age of 12, yeah? Okay, so human papillomavirus can cause warts. And as a medical student, I had the shocking experience of delivering a woman who had extensive vaginal warts. And the baby's head was stuck in her vaginal canal. And I had to do an episiotomy. That's a cut you do so that you can help the mom to deliver the baby. And this lady was bleeding like crazy. I panicked. I didn't know what to do. But fortunately, we were able to control the bleeding, and the baby was delivered safely. When that baby was born, when he cried, he had a hoarse voice. And looking down his throat, he also had papillomas in his throat. So mom had been living with this virus, and it had been spread to her baby. And so the baby also got laryngeal papillomas. So the ENT surgeon had to go in, cut out the papillomas, and the baby's voice became better. This virus is not new. It's not like COVID. It's been around for years and years and years. And indeed, the vaccine, human papillomavirus vaccine, they started to develop it over 30 years ago. 30 years ago, where were some of you? I know your youth, maybe your parents hadn't thought about you. But the vaccine came into being in 2007. That's about how many years ago? Maybe 16, yeah? And in countries like Australia, in countries like Canada, they were able to start vaccinating their population that was eligible. As we speak now, in Australia, they are no longer seeing women developing human papillomavirus, and the load of HPV has actually gone down. In Uganda, we started vaccinating girls in around 2008 in a pilot study. But the universal access to the vaccine started in 2015 in November. As we speak now, over 8 million girls have been vaccinated, and that is good. But we know the vaccine should not only be for girls. It should be for everyone. But because we are a poor country, we don't get to vaccinate everyone who is eligible. I had the opportunity to travel to the US in 2007, 2008 for my adolescent fellowship. And at that time, they were rolling out the human papillomavirus vaccine. I came home and encouraged my fellow pediatricians to bring their children and at least get the dual vaccine for our daughters. But our daughters were frightened. And so we said, let us also, as pediatricians, get vaccinated. I got vaccinated at 38 with the HPV vaccine. Not because I really needed it, maybe I did, but I got the vaccine to encourage my daughter at that time to come and get the vaccine as well. And so we were rolling out the vaccine in the private center, in the private, in the private area. But we are fortunate now that girls can access this vaccine from the age of 10 years up to the age of 13 for free in our clinics. So men, the reason I'm here today is to encourage you to get your daughters or sisters between the age of 10 and 13 vaccinated, because you can prevent them getting the infection. Prevention is better than cure, dear friends. And every time you wait for the cancer to grow, you're not giving it a chance to be prevented. I'll share with you 3 case studies. The first one is of a 14-year-old girl who we saw last year in April. She was admitted to my ward and she was critically ill. She'd been referred from another hospital. I work in Mulago Hospital on the pediatric infectious diseases ward. And this girl came in when she had a distended abdomen. She was only 14. And she was quite sick. Clearly, she was suffering from something. But when we investigated, we realized that she did have cancer of the cervix at 14 years. This same girl we did a swab of her vaginal canal, and she had 2 other STDs. She had trichomonas vaginalis, and she had gonorrhea, which meant that somebody was sexually molesting this 14-year-old girl. Taking a further history showed us that from the age of 4 years, this girl had been sexually molested. My call upon you, men, professionals, is not to participate in molestation of girls, but also to report those who molest them. But her life was cut short. Why? Because she presented with disseminated squamous cell carcinoma of her cervix. I'll share with you another story, and this is of a 41-year-old lady who I knew. She was a really good mom. She had 5 children, just like me. But at 41, she got cervical cancer. She presented at first with spotting. Spotting means you have your period, but in between the period, you're seeing drops of blood on your panty liner. And then she developed abdominal pain. And then before she knew it, she was quite sick. And at 41, she lost her life. This lady had gotten married at 15. And her husband is a high-ranking official in this country. Little did we know, this gentleman also had other wives who we didn't know about. Gentlemen, I heard you announce, I'm married to 1 wife. If you're married to 1 wife, please let it be 1 wife. Not 1 wife who's the donkey at home and then the zebra in the forest. Be married to that 1 wife, because it is important for you to zero graze. The third case I want to share with you is of a 28-year-old nurse. For those of you who watch Big Brother, anyone in this room used to, one day watched? So this lady was a nurse, and she was only 28 years. And she was one of the most brilliant participants of Big Brother UK. sadly, she too got cervical cancer and she died. This evening, I've not come to give you sad and drab stories about dying. Each of us is going to die, but how do we want to die? Ofudotia, that's a question. And indeed, some deaths are preventable. So my call to you today is, one, let us prevent the number of deaths among women who get cervical cancer. We know that cervical cancer is the second most common cause of cancer among women. And Dr. Eliona will tell you that on the gynecology ward, the first case of cancer among gynecology patients is cervical cancer. And as we speak now, I've been here for barely 5 minutes, but we've been here for over an hour. And in this short period, nearly 10 women have died of cervical cancer. Let us stop this scourge. And yes, we can do it. By doing what? Prevention. Prevention how? Vaccination. Because vaccination works. We'd like to see boys and girls being vaccinated because I told you that boys and girls can get HPV. And boys and girls can both get cancer. Now the trouble is, and I'm sure that the gynecologist has told you before, when a person gets HPV infection, it stays on the mouth of the womb for even up to 15 to 20 years, quietly sleeping. But at that one point, it starts to demonstrate and reproduce and cause the production of cancer cells. So it will keep there quietly in the opening of the womb. And that is why we must go as women for pap smears. If you are older than 20 years and you are married or you are sexually active and you're in this room and you've not done a pap smear, wake up. The doctor will put you in a lithotomy position, that position which many women deliver in. I wouldn't want to demonstrate, but if you lie on the table and you put your knees up, that's called a lithotomy position. So the doctor will order and then look at it under a microscope. And they'll tell you if you're at risk or if you're at serious risk. If you are at serious risk, then you'll be sent to your gynecologist and treatment will be given. Please do not show up when the cancer has spread to the liver, to the bones, or to the lungs. That is called stage 4, and it is a little too late. Gentlemen, please observe yourselves. I'm not saying touch your neighbor parts now, but when you're taking a shower, if you find a little bump, some are painless bumps, some are just, pearls, they are painless, they are harmless. But if you have a growth, do not keep quiet with that growth. Be full of lesions like cauliflower. Do not wait for those lesions to start bleeding. Because if they start bleeding and maybe start smelling, then maybe you have penile cancer. The doctors in this room know that penile cancer is one of the most stinky cancers. If somebody walked into this room with penile cancer, we would all run out of the room. Because it stinks. And the treatment is to chop off that organ. So, if you have a hoarse voice, and you're talking and your voice is hoarse, hoarse voice means dobozi risakade. Do not wait and think, oh, it's just a sore throat and you self-medicate. Go and see the right doctor. My son is an ENT surgeon, and right now he's doing a fellowship in throat, head and neck cancers. And they're finding a lot of throat cancers, but also other head and neck cancers, which are related to HPV. So let us all wake up and smell the coffee. Gentlemen, your role is clear. Let us be what we are proclaiming to be. Good Adventists who pray and marry and stick to one wife and a wife. Not a? Okay. So anyway, I'm just saying that if you have a child in your care and they are not vaccinated, please make sure you get them vaccinated. If your wife asks you for transportation money to go and get checked for pap smear, please give her the transportation money urgently. Temulinda za kameza zokka. Ne transport yaba very important. My friends and I published a book. Eliana, if you could please pass it around. It's a cartoon. It's a comic book. But we thought that in order for us to talk to young people, it's a book that can be read by a child in P3. So for you guys, if your eyes are good, you can read it in just 3 minutes. It's about promoting HPV vaccines and explaining as to why we should really get these HPV vaccines in the arm. It's an injection that is given in the upper arm. And if you're a girl between 10 and 13, you get 2 doses. If you're older than 15 years, then you're going to get 3 doses. As you heard, we run an adolescent clinic at Mulago. It's open every Friday. And we see these children for free, 10 to 19 years. If your child has not been vaccinated, and probably they missed being vaccinated at school, or you have a friend or a girlfriend before the age of 26, they can still come to the clinic, get vaccinated for free. So as I summarize, so that I allow you to ask questions, let us be aware of our own health, because health is wealth. We don't want to lament, Bambi, yafudde cancer, and another day, Bambi, yafudde cancer, when we can prevent it. There are other vaccine-preventable cancers, and one of them is liver cell cancer. That can be prevented with hepatitis B vaccine. And so, as we continue to prevent cancer and other non-communicable diseases, dear professionals, it is your entire responsibility to be responsible for your own health. Do not sit for too long. After every 40 minutes, I've heard some of you are IT experts. I heard about a draftsman. My daughter is an architect. And we encourage her to stand up, Tracy, and do something. Do not sit for too long. People get clothes. And Eliona, you'll allow me to let this group stand up because I've seen they've been sitting for over an hour. Learn to exercise. Do not be, I don't want to use the word coach potatoes. Do not be coach potatoes. Learn to exercise. Learn to be free with your bodies. Okay, somebody is doing the exercise for us. You can come ahead and show them what to do. Thank you. Music. DJ, please. DJ, what song do you want?
And please call Jesus.
so much. That was way beyond what I expected. Give her another round of applause. So take good care of your own health, exercise, do not sit for too long, but also make sure you sleep enough. And obviously eat a balanced diet. I know many of my Twitter friends here are going to say she's obviously going to talk about milk and yogurt. Yes, drink your milk, drink your milk, drink your milk. Because it contains, yes, it contains vitamin D, potassium, and as you drink your milk, exercise. Yes, milk. You're not too old to be drinking milk. I wouldn't be wearing my cool 4-inch if I wasn't drinking my milk. And then let us encourage our partners. We are our partners' keepers. Ladies, I've told the gentleman to accompany you, if possible, to do your pap smears. But ladies, remind your spouses to also go and do that critical test called the PSA, the prostatic surface antigen. All of us, it's our responsibility not only to get our vaccines up to date, but also to ensure that we get checked for our health on a yearly basis. You could time it before your birthday. You could time it just before Christmas. Hopefully you will not get a bad result. But go and get tested. You need to know where your baseline is. The bare minimum is know your weight, know your height, know your waistline. And gentlemen, please remember to learn the size of your wife's bra. Don't buy the wrong bra size. And last of all, like I've always said, keep your own adage. What makes it special for you? What makes you stand out from the rest? Mine are 4 things, and they are the ABCDs of my life. The first one is ask for what you want, be who you say you are, care about others, and dare to live your dream. Some of you may want to live for the next 100 years, or even 400. Who knows? I mean, Moses lived for how many years? More than 100. Everyone wants to live for a very long time. Take care of your health, and the rest God will take care of it. I'm going to stop here so that you can ask questions. Thank you.
Thank you very much, Dr. Sabrina. Another hand clap for her, please. So before we go into the Q&A, I want to emphasize just a few points. When we talk about cervical cancer and we talk about women's health, I get triggers because these are things that happen every day. And just summary of what she has said, I want to emphasize having multiple sexual partners and your partner having multiple sexual partners, because if we are talking about the cervix, we are talking about something that is sexually transmitted. So HPV, yes, we find it in the throat, we find it elsewhere, but it is sexually transmitted when we talk about cervical cancer. Having said that, this may not be very good news, but Dr. Sabrina said we say it the way it is. You may say, yes, I'll use condoms to protect my wife, to protect my girlfriend. Condoms are not protective against human papillomavirus because we find it even on the skin. Unless you're going to get a whole condom that you wear your legs and, you know. Yes, so they are not, yes, because as Adventists, you know, we can just use condoms, we can just do this. They are not entirely protective against human papillomavirus. screening, she has mentioned it, and I want to emphasize this. And my president, I keep telling him in most of the retreats we are having, that is why we always pack, Dr. Sabrina, we pack acetic acid. You know, that's the simplest we can do. We always screen. Those who are going to Chisoro, those who are going to Chitimbwa, you know, Dr. Ronald, we've mentioned this, and we have a package. Please don't have a retreat and you don't include acetic acid or a PAP. These are simple things that we can do, and the supplies are always available. You can speak to us because you do not know. She mentioned a 14-year-old. 14-year-old. So that is 14, and here we are, 20, 30, 40. We don't know what we are harboring inside. So kindly screen, and that is a way that we can prevent. So our husbands, our men, when we ask you for transport money, please just give us mutuwe tugende to screening as much as we can. Yes, Oscar, praise God, my brother. Mutuwe tugende to screening. Something specific that we always talk about, family planning. Dr. Sabrina Bagamba, those who use family planning, especially oral contraceptives, bebasanga with that human papilloma virus mainly. So those are some of the myths that we want to correct. We'll wait for the questions. However, it all has to do with hormonal imbalances and how that HPV concentrates there at the cervix. She mentioned something about how long it stays. Yes, it can stay for 10 years. That girl was molested from 4 years of age. So if you screen within that period, you can actually reverse human papilloma virus. So advocacy is also very good, and we thank our president and the team who have been able to give us this opportunity to talk about the role that our men play in either prevention or the women getting cervical cancer. Thank you very much.
Let's give them a better round of applause, ladies and gentlemen. Would it be too much if I asked you to sit just next here? This moment that is just coming now is a serious one. 1, 2, 3. Bonamba kue. Okay.
Thank you very much, Doctor, for the best presentation ever about cancer. I think it's the first I've had. But, okay, I'm confused. What's perineal pop? What is HPV? What's cervical cancer? What's the difference? And if there is a difference, what are the symptoms and signs of these things? Maybe someone could be experiencing some when we don't know that we have them. The other thing is, after knowing that maybe these are the symptoms and maybe I'm sick or I'm not, or okay, let's say after knowing that you're sick, does the vaccination still work?
Okay, thank you very much. Drafter, right? Okay, perfect. Penile cancer is cancer of the cervical cancer is cancer of the. Do you have one of the two? Okay, so one more question. And doctor, you said we talk, isn't it? So we'll talk them. At least he has one of the two, so he's not safe in any way. Was there an arm here?
Thank you, Dr. Sabrina. I like the fact that you're very well collected, and if I was to do medicine, I think you would have been one of my icons. He has asked one of the questions, but I also wanted to know, apart from being sexually transmitted, would there be any other way someone could get the cancers that you've talked about? Then also about what are the costs for screening? Because it seems to be a very common cancer, I think, lately. And we rarely hear of camps, all free medical camps about the same. I've heard of one, I think it was in Mulago. Then I also wanted to know about the signs and symptoms, since it's a silent killer. Thank you very much.
All right, the last person in this row.
Thank you, Doctor. Thank you, Doctor. And I wanted to add something on his question, like I thank you for the information, but I'm requesting you to kindly guide us about the tests we are supposed to do alongside other women's tests they are supposed to do. Because, as you have said, for the women, about the HPV, then for the men, I don't know if we all have to do all those tests also, or if there are certain tests we are supposed to do. Thank you.
Okay, thank you. As the doctor answers, I think she talked about the cauliflower that you need to watch after. If you see some kind of cauliflower around your, that one. Doctor was bold enough to mention it. Yeah, he talked about it. That one he talked about. All right, over to you, doctor, and then I'll cross over here. Or would you prefer to get? Sure.
Thank you all very much for the questions. So my colleague said that uptake of HPV has been extremely low. Yes, that has been true in the previous maybe 5 years when we had just started. But I've just looked at data from the Ministry of Health. I'm just exiting from the UNITAG, the Uganda National Immunization and Technical Advisory Group. So I get privy to data from the Ministry of Health. And the good news is Uganda has stepped up the game. The district that had the lowest immunization rates for HPV was Kasanda, and that was for the first dose and the second dose, they were up to 19%. But for some districts, they've actually even hit beyond 100%, and they're at 105%. Because look, we say vaccination of girls 10 to 13 years, but I know that because of the mobilization, because of the advocacy, some people are taking their daughters who are older than 13 to get vaccinated. So we are in a good place. And the WHO is soon changing the vaccination schedule to just 1 dose, and that will be enough. Various studies have shown that giving 1 dose in some places has shown some good response. So just 1 dose may end up being the only dose for children below 13 years. For those of us who are older, you're not a child. Your immune system, and so you need more doses. If you're above the age of 15, you're definitely going to need 3 doses of the vaccine. And I know that the SAGE committee in 2008 also recommended that women up to the age of 46 can be vaccinated, as long as your pap smear is negative. So thank you for the contribution, Gene Expert and DNA. And I know I just whispered to Eliona, don't you do camps where you do DNA screening for the professionals, for the advents, and it is absolutely free. Sadly, you don't show up. What are you afraid of? There's a saying in my language that okwerinda sibuti. Knowledge is power. When you go and test and you're negative, you go home and jubilate. But if you go and test and you find that you have a lesion, they will treat you and your life will be saved. So that was really funny about, do men have a cervix? How many men here have a cervix? Please don't go away thinking you have a cervix, gentlemen. You do not have a cervix. The cervix is the opening of the womb. Okay? If you look at an avocado, the place where the stalk of the avocado is removed, that's similar to where the cervix is. Okay? Gentlemen, you have a penis, and it's so sad that men are the most embarrassed to say the word penis. Even men doctors, If you ask the male doctors tell us about the female sexual organs, they will draw the uterus, the fallopian tubes, the ovaries. Tell them to show us where the prostate gland is. They'll be scratching their heads. Don't be embarrassed to say the word penis. Yeah. Say the word penis. It is absolutely a normal organ. How come you can say breasts, you can say vaginal canal, but you're afraid to say the word penis? It's on you. We don't have them. Okay. So circumcision. By a show of hands, ladies, close your eyes. How many of you are circumcised gentlemen? Ladies, close your eyes. Okay, pretend to close your eyes. I'm the teacher. I am the independent party here counting. Gentlemen, circumcision is an effort to reduce sexually transmitted infections. And studies have shown that men who are circumcised, we know Jesus was circumcised at the age of 8 days. So how can matters of the heart be circumcision? You should be proud and say, yes, you're circumcised. Good job. And when you're not circumcised, some people do not know how to bathe properly. And so the foreskin stores a lot of the HPV, the gonorrhea. I don't want to talk about all those STIs. There are many. Abamu tebanaba. Ate tebatukula. I'm not saying those words, I'm echoing them. So save yourself tebanaba, tebatukula, baunya by just cutting off that foreskin. Where do they take it? So after knowing that you're sick, is vaccine still useful? Actually, no. When you have cervical cancer, you cannot get the vaccine. It's a little too late. The interventions are different. The interventions will include removing the entire uterus or doing radiotherapy or doing other things like treatment, but you don't get the vaccine. On the other hand, I have seen, because I run an adolescent clinic, I also run post-defilement clinic. I saw a 2.5-year-old girl brought in by her father. And this girl had extensive anal warts. Ensundo, mukabina. So when we talk about human papillomas, those are warts. In Luganda, they are called ensundo. And those ensundo can be so many. And they were like a flower in this girl's anal area. At 2.5 years, we vaccinated her. And those ensundo dropped off. So in some cases, when people have extensive warts, vaccination can be part of the treatment. But if it is cervical cancer, if it is throat cancer, if it is anal cancer, you have to get a different kind of treatment. Now, cervical cancer sneaks on people. It's like a thief in the night. Like I told you, the 3 cases, one was a 14-year-old girl, one was a 28-year-old celebrity, and one was a 41-year-old mother of 5 children. It can be any one of us. So be smart, be wise. If you're called upon to be part of the camp and get a free pap smear, make it your responsibility. Gentlemen, those of you who are not here with your wives, salongo sebo. Omchala wabanga teyagenda kufuna pap smear. Encourage her to do her pap smear. Thank you. Give him a clap. Thank you for the compliments. I truly appreciate. Now, if you over-test for something, you'll get results. The case doctor shared about the man who was in his 70s and had a raised PSA. PSA is prostatic surface antigen. It is just a measure of, is your prostate gland producing a lot of prostatic surface antigen? And it is a marker of prostatic cancer. For men above the age of 40, please go and just do your PSAs. But also, we know that the prostate can either become cancerous or become enlarged. And after the age of 40, 45, men start, instead of peeing very far away, the pee is nearer. It's possible that the prostate gland is enlarging. And so you may need treatment for that. Most men, and these are studies that have been done, by the time they reach 75 years and they die, the doctor in the mortuary, called a pathologist, is going to test the whole body. But nearly 7 out of 100 men may have died with prostatic cancer unknowingly. To live until 100. Be like the Japanese. They live until 120 years, and by 80 years they are saying young man. They suffer from a disease called longevity. But why should Ugandans die early and Japanese die at 120 years? Because they take good care of their health. But here, they call you for a test which is free, and you don't show up. Gentlemen, the wives ask you for transport to go for that test, and you keep it and say, nakuwa dede za kameza. Gentlemen, you are the heads of the home. Be responsible. Lead, and others will follow. Thank you.
Oh, let's give Doctor a better round of applause. So the last session of question comes from this side, and I'll pick 3. 1.
Thank you, Dr. Sabrina. My question was asked by someone, but I think you haven't tackled it. So apart from PSA and physical observation of the penis, what other tests can men do to curb cervical cancer?
Okay.
Sorry, just to say, men do not get cervical cancer. Men get other types of cancer. Okay? Penile cancer, anal cancer. If you find an overgrowth, you're passing stool and there's blood, you have pain on passing stool, that means somebody needs to look down your anal canal and find out what's actually going on. Do not sit at home and think you're going to sit in a bath of hot water, I don't know what else. But just before I forget, HPV is a sexually transmitted infection. And I usually tell people that it's not only spread by sex. It can be spread through kissing. So be careful of who you just go kissing and exchanging saliva with. You could end up with HPV.
Thank God they are all saved here.
I wanted to add something onto what
No
Dr.
possibility.
Sabrina said. Before the next question, I think it's that Joy, the question about the tests that men can do. Unfortunately, HPV has more than 100 types. So the types that are specific for cervical cancer are 4. And when you go into DNA tests, you have HPV E2, HPV what? Now, there's a time we advertised and we called upon all ladies to come and have free HPV DNA tests. Only one of you came. This was a free DNA test. But now, talking about the test, unless they take off his blood, and he probably has HPV DNA E2, which is a high-tech test, it is really difficult since they don't have a cervix, difficult to have a test that is going to help the partner. Okay? But also we have realized that sometimes the elderly, not everyone will have the attitude that is not very, it's not smelling normally. That is something that can trigger your thought. For the health workers here, we usually give metronidazole, but it is good to always look there. It is a simple test. Look there. You may be dealing with cervical cancer. You may be dealing with papillomas that are not are things that are taking us towards the route of cervical cancer. So a foul-smelling discharge, when you have sexual intercourse and you bleed immediately after sex, and it's not your period, you're not in the time of bleeding, that is also something you should come and talk to a gynae. We have to look there and see. When you have, it is called intermenstrual bleeding, usually after sexual intercourse, or even you just see a spot and it is not related to family planning. It is good to report to a gynae. That also rings a bell. And as Dr. Sabrina said, nowadays age is something that we don't really look at. As early as 2014, you can have stage 4. So we have PV bleeding, we have a foul-smelling discharge, we have abdominal pain and backache. Don't sit, go and talk to your gynecologist. And then screen as much as you can. Thank you.
Thank you, Dr. Sabrina and Eliona. Partly my question has been answered before I asked it. I was going to ask, is cervical cancer, can it be passed on from mother to child? If so, how can it be treated? The other was a compliment, as just complimenting saying or supplementing saying that men are #1 causes of cervical cancer in women. So if you're here and you're sexually active and you have a man, please note that you are at risk.
And repent. Yeah, we don't forget that. The last person here, Brian.
Thank you so much, doctors and the medics here. You've organized for us a very wonderful fellowship this month. It will be remembered.